I'm Lisa Presnall. I'm a nurse first and foremost, but I'm also a nursing professor at Concordia University. And when I'm not busy working on the 3 to PhD Wellness Center, I'm busy teaching students. So several of those are in the audience today. I wanted to talk to you a little bit about what we're doing differently in educating nurses, given some of the changes in healthcare and the things that need to be happening. Mother Teresa made a really cool quote that said, "The most terrible poverty is loneliness and the fear of the tragedy of being unloved." And I think that really sets the tone for what I wanted to talk about. 1 in 5 kids in Oregon actually are living in poverty. And when we say poverty, we're talking about deep poverty, like is demonstrated in the other graph, about less than 50% of the poverty level. And we're talking about 7.4% of the people in Oregon are living at that level. That's a problem. So one of the things that we're doing is we're taking students out into the field because healthcare is moving, in case you haven't heard this already in the media, it's moving out of the hospital and into the community. And while there are still the holdouts and those of us that are older like me who think it's going to be in the hospital forever, I've been converted to believing that it's actually not. So one of the things that we're trying to do is find a way for students to interact in a meaningful way very early in their student experience and then carry that on to their career. So when we're talking about introducing students to the community, we want to look at ways that we can also meaningfully interact with the healthcare system as it exists, as opposed to being an additional burden. So decreasing ED usage, et cetera. This is where we find a lot of our folks. And we also go into some single-room occupancy hotels downtown. We work with the Fabian community, we work through the Maybell Center, and we do visits with folks who really have no one and are disenfranchised in many, many different ways. So I've challenged the students. They've learned through Poverty Sim, that's the first thing they got to do when they were juniors, and learned a little bit about poverty, but that's just what it says, it's a simulation. The rubber hits the road when they get downtown or get into one of the housing projects that we work in, and they've got to figure out what's the problem, based on what the community says, what's the probable solution, and what can they physically do about it that's sustainable over time. So they smash watermelons to show kids how not to go without their helmets. We've used a whole lot of organizations to work with us and partner with us, and so partnership's a huge piece of this, and if you don't have that, if you're not fortunate enough to have that, it's really hard to pull off these interventions, so I do thank all these organizations. But one of the things that we also did was we took some of our able-bodied students and said, what are we going to do about making community at another center where there was none? And so they took a basement and converted it into a community room so that people would have a place to gather and communicate. Kids could get school help there if they needed after school. And when there's a food problem in the neighborhood, we just heard about food insecurity. Food and housing are huge with this population. So we create food, but we do it in a healthy way so that we can use the box food that we get from the surplus and such that's handed to the kids, and we teach them how to use that in a healthy way to create meals and snacks. And if you're out of toilet paper, we'll fix that too, because we gathered 4 cars full of goods, much of it toilet paper, and took it downtown and served folks who really had health and hygiene needs in the city. So foot care, that's another one that's interesting, and it's something people don't usually think of when you think of healthcare necessarily, but this is one of the most meaningful ways for our students to connect with patients. One of the things we're trying to do is find funding to be able to continue that healthcare, using people's feet as a conduit to their relationship with them. And kids don't have green space, but we do on Concordia's campus, so we took a bunch of the kids over and teamed them up with the nursing students. Yeah, that's who that is. And the soccer team, and we had a great game of soccer last year. So we really have worked hard at this. When you talk about bringing people into the community, you have to be willing to think about what really matters to folks there. Getting people's blood pressure screened is one thing, but if you bribe them a little bit with a smoothie that has all the great ingredients that they should be having in a regular snack, and you don't tell them until afterwards what it is, the kids actually buy into it. It's pretty amazing to us. What we're hoping for is people having a family experience, a community experience that's meaningful to them, that still creates a learning experience for the students. These are some of the organizations. I have more back on the table. We would love to have you partner with us. We could use all the help we can get. A lot of folks out there. Thank you.